Are you over 40 and starting to feel different? Maybe intimacy feels uncomfortable, even though everything seems clean and normal. Or maybe you're tired, your skin feels dry, and your sex drive just disappeared. You're not alone, and you're not broken. These are real menopause symptoms. Behind them is one powerful shift, a silent but steady estrogen decline. In today's video, we'll explore exactly what's happening inside your body, and more importantly, how to naturally restore hormonal balance, relieve vaginal dryness, and reignite your energy and confidence. Hi friends, Dr. Emily here, an OBGYN and women's hormone health specialist, and a straightforward voice of science-backed truth here on YouTube. If you've been searching for real answers to hormone imbalance, you've come to the right place. For many women, entering their early 40s marks the onset of perimenopause. Estrogen levels drop by about 50% at age 40 compared to age 30, and by the mid-40s may fall to just 20 to 30%. This hormonal shift is not a failure. It's a signal that your body needs support. Its effects range from vaginal dryness, loss of sexual sensation, and low libido, to more systemic symptoms, hair loss, insomnia, weight gain, and persistent fatigue. But there's hope. Natural menopause relief, natural hormone therapy, and menopause diet strategies can significantly improve symptoms without immediately resorting to prescription hormone replacement. To quickly improve the condition, Dr. Emily often advises patients to refer to the following 4 strategies. The first, nourish yourself with healthy fats and phytoestrogen foods. Including healthy fats in your diet, found in grass-fed beef, free-range poultry, and pasture-raised pork, is essential. These fats supply cholesterol, the raw material your body uses to produce sex hormones, like estrogen. Plant foods, like soybeans and legumes, contain phytoestrogens, compounds that mimic estrogen's effects, softly and naturally. Together, these nutritional strategies support both hormone production and cellular health. The second, move daily to boost pelvic circulation. A simple habit like walking 30 minutes daily helps circulation, especially to the pelvic region. Better blood flow supports ovarian and adrenal gland function. It also enhances mood, reduces anxiety, and helps mitigate hot flashes, night sweats, and sleep disturbances. The third, moisturize locally by natural vaginal inserts. For those experiencing vaginal dryness or discomfort during intimacy, consider vaginal suppositories made with plant extracts and beneficial probiotics. These products hydrate and increase natural moisture, promote gentle cleansing and odor control, support vaginal pH balance and reduce recurrent infections, enhance intimacy by improving sensation and comfort. We ensure to choose formulations safe for the vaginal mucosa, preferably with herbal extracts, and consult your OBGYN before starting. The fourth, support hormones naturally by supplements and lifestyle. Nutrients like maca root, vitamin E, and soy germ can ease symptoms like hot flashes, sleep issues, and libido loss without the risks of synthetic hormones, provided you have no contraindications like estrogen-sensitive conditions. Other essential strategies include a balanced diet rich in whole foods and micronutrients, parsley sleep habits and stress management, avoidance of excessive alcohol, nicotine, and chronic stress. These lifestyle measures work synergistically to regulate your endocrine system, supporting mood, vitality, and sexual health. Why it matters: clinical perspective and education. As an OBGYN, I often encounter women who feel ashamed or fearful of intimacy due to dryness or lack of interest. What you're experiencing isn't aging failure. It's a signal to care for yourself in a more informed, compassionate way. When estrogen declines, referred to in medical terms as hypoestrogenism, it often leads to vaginal atrophy, urinary symptoms, and decreased sexual comfort. But this condition is common and manageable. Lifestyle, nutrition, and natural supplements can collectively restore balance. Some individuals may eventually benefit from bioidentical hormone therapy, but only after thorough evaluation. In summary, if you're a woman over 40 navigating estrogen deficiency, low libido, or vaginal dryness, know this: estrogen begins to decline significantly by age 40 to 45. Symptoms like dryness, loss of desire, mood disturbances, and poor sleep are not irreversible. Adopt a holistic approach. Eat healthy fats and phytoestrogen foods. Walk daily. Consider safe vaginal support, and reinforce hormones naturally. Consult with a qualified OBGYN before using supplements or hormone therapy. Thank you for listening. As your partner in women's health, I'm here to reassure you. What you're experiencing is a treatable phase, not a broken phase. With the right care, education, and natural strategies, perimenopause, menopause, and hormonal imbalance need not diminish your quality of life or relationships. Please like, subscribe, and share if you found this useful. For more videos on perimenopause, natural estrogen balance, and midlife wellness, stay tuned. I'm Dr. Emily, wishing you vibrant health and renewed inner strength.